We're live. So today, really looking forward to this interview. I think it's going to be a lot of you out there who've got lower back pain are really going to enjoy what Charlotte's got to say. So I welcome Charlotte. Charlotte is an advanced practitioner physiotherapist with a special interest in the spine. So we're going to ask her some good questions today that normally get asked. So I'll hand over to you, Charlotte, if you want to just introduce yourself a little bit better.
So hello, as Andy said, I've been a physiotherapist now for 20 years. I've worked in various NHS trusts. I currently work in a local one, as Andy said, as an advanced practitioner with a special interest in spine. I've worked in several private practices as well, and I recently joined the Summit team pre-coronavirus, and we'll look forward to getting stuck in a bit more, hopefully when life returns back to normal a bit. I've done lots of studying since I graduated, did a master's degree several years ago. I've got 3 young children. We lead a very active life, and yeah, that's me.
Fantastic. I think we'll just get stuck straight into it. I mean, I guess my question will always be, as somebody who sees a lot of lower back pain patients and some complex ones, what's the most common question that someone would come in and ask you then?
So I'm sure every physiotherapist would probably answer this in the same way. Basically, people want to know what's wrong with their back, understandably. And when you see any healthcare practitioner, whether that be a physio or a doctor, we have quite a similar way of helping you understand that and helping us come to a diagnosis. We ask an awful lot of questions initially, and sometimes that's a frustration for patients. They feel like they're going to get the answer from what we actually physically do when we look at you and get you moving and feel your back, but actually the richness in the information comes from what you tell us. And by the end of that questioning, probably 99% of the time we have a diagnosis already that the physical assessment just kind of adds strength and support to. So most people with back pain, approximately 95% of people will have what we call mechanical back pain. Mechanical back pain is an umbrella term that we use as healthcare professionals to describe pain that comes from the joints, the soft tissues, nerves in and around your lower back. And this back pain is good back pain. It gets better with the right advice and the right treatment. We've learned through experience and through research that actually trying to specifically label structures to give you a specific diagnosis, such as a disc prolapse or arthritis, we're not accurate, and giving those specific labels can be unhelpful for people moving forward, because quite often they're given a different description from two or three different clinicians that they may have seen. So we use the umbrella term mechanical back pain, and in most cases the same type of treatment approach works. Therefore, labeling it more specifically isn't always helpful. There's a much smaller percentage of people that present with back pain who also have leg pain. So this is pain that goes all the way down the leg into the foot. It can be described as sciatica, or nerve root pain, or radicular pain is another descriptive term for it. And this is quite a small percentage of people that have back pain develop this long leg pain as well. And this is when the nerves that exit your spine become irritated and sore. So again, the way you describe that, how it behaves, gives us that diagnosis as well. And then finally, and reassuringly, of all the people that develop low back pain, there's only 1% of back pain that's due to anything more serious. And again, this is something that we tease out during the assessment process for those patients that we are a little bit more concerned about, and we need to take a different course of action in terms of diagnosing and then managing that type of back pain. I don't know, would it be useful, Andy, do you think, to just mention what the signs and symptoms are that we look out for more concerning back pain problems, so that people are aware?
Yeah, I think so. I think you know, I think quite like what you've said there, I think what's quite reassuring is, like, for most people out there who have got this, and we're going to go on to talk about what people could be doing if they're currently suffering from it. But I think it's also important, in my opinion, there are more serious conditions that the 1% that you're talking about. So I think that might be just important to just touch on a few of those.
So these are, like Andy said, just an awareness for to perhaps act quickly and understand what perhaps isn't normal back pain. And so if you experience changes in your bowel or bladder habits, any numbness around your back passage or genital area, any change in sexual function, and leg pain going down both legs that's associated with a new severe onset of back pain, then this could be a sign that there is some irritation or compression to the nerves in the very lower part of your back that supply your kind of pelvic organs, so your bowel and bladder. And that's something that needs to be identified quickly and managed and treated very quickly. So we would always recommend people with those symptoms get themselves off to A&E to be assessed quickly. Other types of back pain that we tend to explore a little bit more quickly as well is if you're unwell with it, so if you're running a temperature, a fever, if you're losing weight, or if you've had any significant trauma associated with your back pain. Obviously we need to understand if there was any bony injuries as a result of that. So that's the 1%. They're very few, and we won't say any more about that, but just something to look out for.
Well, I think it's important. I know we're going to continue with the kind of mechanical back pain discussion. I think that's something which, because like you say, if 99% of the population, if that's what they suffer with, then that's actually something that we need to, we need to discuss in detail. But I think it also is important for people out there who potentially those symptoms do occur, that actually there is an immediate need to then go and seek help. So I think it's important to touch on it.
Yeah, and I think if you think about the number of people that experience back pain, in 80 to 90% of the population will experience low back pain at some point in their life, and quite often will experience it again in the future. So there's an awful lot of people. So 1% of that is an incredibly small number. So
I guess the positives is, I like the way you called the mechanical back pain good back pain. I like that. I think that's a positive spin on it, and the things that it will get better. But you touched on the fact that 80 to 90% of people probably will occur it, and that's a statistic which has been very well researched, hasn't it, and very well shown and proven. So I guess most people always want to know is, well, what caused it in the first place?
Okay, so there's several things that we tend to explore with people around this. So obviously a trauma, an injury can result in back pain. So that might be a car accident, a fall off a bike, fall off ladders. And so there's always a potential trauma that can be a trigger. The ones that tend to, and that's kind of, people can rationalise those fairly easily because there's been a direct incident that's triggered the back pain. The people that present with back pain where they can't relate it to a specific injury, they often struggle perhaps a little bit more to accept the pain and accept the situation that they're in, because they've not got something to pinpoint it on. And we often, people will say, look, all I did was bend down to pick up a sock or to tidy up some toys, and, look at the state I'm in now. And what we tend to explore with these people is, okay, well, that was the final trigger, but what's your life like? what's kind of been going on that's perhaps led up to that moment. And we really explore people's lifestyles as part of that. So, you know, what do they do for a living? Do they exercise regularly? You know, do they tend to use their bodies repetitively in a particular pattern that's perhaps loading their spinal structures in a repetitive way? And are they doing anything to counterbalance that, you know, with their exercise regime? So there's often an awful lot of physical triggers that would lead up to an episode of back pain. But in addition to that, you know, there's lots of other factors that we know make you at risk of back pain. Being low in mood and suffering with depression, having significant stress in your life, whether that's related to work or personal circumstances, having poor quality sleep. All of these things we know can make you more susceptible to experiencing low back pain, and also can influence your recovery from it as well. So this is where our skills as a physiotherapy profession are really important, and perhaps unique to some of our other medical colleagues, in that we don't just look at you physically, we look at you as a whole, and we look at your life, because we know, you know, there's often a multitude of factors as to why you've developed back pain.
I think it's really important to touch on. I think firstly, what I think for reassuring for lots of people listening who've had low back pain, I think, you know, one of the, especially there has been a few myths and misconceptions. If we're going to go and see a physio, they're not going to listen to me anyway. But listening to you, who's that, you know, are very experienced in, you know, you've opened with the fact of, you know, that the most important thing is to actually stop and listen. So I think that's really nice for people to hear and understand that actually when you do go into a healthcare practitioner, that people are going to seek to understand you. And we may be asking questions that are not related to your back pain, about your lifestyle. And I think what's quite nice is you've just clarified lovely why we do that, because there are so many other factors that could be that could be the reasons why, or could be participating or a part of that, the reasons why. So I think it's important for people who are going to seek help now or in the future to understand that that's the kind of questions that you may be asked. Be prepared to understand why we're asking those questions, because we want that whole holistic view of how we can help you and get better. So I think that's a really lovely way you put that.
Yeah.
So one of the other questions that I know you must get asked it, because I know we get asked it loads in clinic, is, well, I need an MRI scan for my back.
Well, majority of the time, no. So this goes back to, I think, our management and understanding of back pain is evolved hugely, certainly in my 20-year career, and I think you've been qualified a similar length of time, haven't you? And we traditionally, back pain was very much perceived as structures at fault that gave pain, and that if we can have a scan, we can see those structures at fault, and then that'll tell us the answer, and we can get you better.
Yeah.
And over time, we've realised that actually what scans show us has no bearing on the level of pain that somebody will be experiencing. There was a really nice study done a couple of years ago that looked at people without back pain from the age of 20 up to 80, and looked at what the scan showed. So these people had no back pain, and in your 20s you've got a 20 to 30% chance of finding disc bulges on your scan. Also age-related arthritic changes to the joint in your back as well. And this gradually increases as we get older, and by the time you're in your 80s, you'll have, you know, the chance of disc bulges is over 80%, as is the arthritic changes in your back as well. And I think that study is one of many that have been done, really demonstrates that these people had no pain, yet they had all these changes on their MRI scan. So that MRI scan is meaningless. It doesn't tell us anything. It's, you know, our spines age like our hair ages and goes grey.
Careful
And
about hair, please.
but there's only very few situations with back pain where an MRI scan will help us. And the way they help us is by directing the type of treatment that might be appropriate for you if you haven't improved with all the normal conservative treatment. So conservative treatment is physiotherapy, education, advice, exercise, lifestyle. So if you've not improved with what we know works, then an MRI scan may help guide other treatment options. What it doesn't do is tell us what the problem is. We know what the problem is. The MRI scan supports that and then directs you to treatment. So the times when an MRI scan is useful is if with mechanical low back pain, it's not useful because there aren't any other treatment options that we know are effective other than our conservative treatments, which we'll come and talk about a bit later on. So if it's pure back pain, an MRI scan adds no benefit. And in actual fact, it can make people worse in the longer term. And the reason it can make people worse is that these changes that we've just explained are seen and they're told about them by their doctor or the health practitioner that's ordered the scan. And if they're not given that information with the context of what's normal and how that fits with their assessment, the patient or client will leave that consultation thinking, well, I've got all these disc bulges, I've got, you know, arthritis, this is the cause of my pain. It starts to develop quite unhelpful beliefs about how they then should use their back. They can start to protect themselves, move differently. And then all these behaviours start to actually develop stiffness, weakness, you know, altered movement patterns that ultimately can end up making them experience more back pain later down the line. So when you're told that an MRI scan would be helpful, we're not being obstructive, or it's not about cost saving. It's purely about, it's not going to change how we treat you, and actually it can make you worse if one, you know, is ordered.
And I have to absolutely second that. You know, having somebody that brought in MRIs and said, look what's wrong with me, and because they found, and my response is going, oh, well, in my opinion, this is totally normal for somebody of your age, and you're joking. No, I think this is absolutely, anything it shows here doesn't even relate to the pain you're suffering from. So, you know, I think it's really, really important. And, you know, I think very eloquently you made that message across. And I think it's important that people understand that, you know, sometimes it can actually affect your mood and how you, and I think that the nice thing you link that straight through is that altered movement pattern, you know, and I think that can only create more problems in the future. So I think that's a really nice point.
I think where I think it's important to understand where it is appropriate. So the times when we would consider an MRI scan is if you're part of that 5% that have the long leg nerve pain. And even then, we expect in the majority of cases, so in you know 80 to 90% of cases, that those symptoms of nerve pain will settle within a 6 to 12 week period of you developing them. And we always allow your body that recovery time because most people will improve within that time frame. If you go beyond that period, so 12 weeks, and your symptoms have persisted, and there's signs when we assess you that the nerve perhaps isn't behaving as it should do, so you may have some weakness or altered sensation to your skin, or your reflexes may have changed. These are all the functions of the nerve that we assess when we examine you. If you have symptoms like that and persistent leg pain, then an MRI scan is appropriate to explore, okay, is there a structure pressing on that nerve? that may be helped by other types of treatments, such injection therapy or possibly spinal surgery. But if they're not treatment options that are going to be considered for you, then again, an MRI scan holds no value. And because we know most people improve within that first 12 weeks, as painful as that process can be for people, an MRI scan within that 12 weeks, again, isn't helpful, because our body often deals with the problem and settles it anyway.
And
So,
I think that's a really reassuring point. And you know, I mean, one of the things we both, you know, fascinated by, we're both, I guess, geeks and love our research and stuff. It's one of those things where the body is a brilliant healing machine as long as we put it in the environment that it needs to be in, you know. And so I think that's the important factor to put in. So one of the questions.
One other thing, X-rays is another investigation that sometimes people ask about, and this is you know, the only time an X-ray is useful is if someone has had an acute onset of back pain and they've had a trauma, and when we assess you, there's specifics on the assessment that make us concerned that you may have got a bony injury. That's the only time an X-ray is beneficial. So going to see your GP with back pain and saying, look, do you think an X-ray, you know, do you think I need one? I think I need one to understand it. Again, they don't change anything. We know what's wrong with you when we ask you all the questions, and it's the same thing. Actually, those results can start to give you unhelpful beliefs. So an X-ray is very similar to an MRI scan, very rarely needed.
And again, that's reassuring. And I think the thing is, I think for a lot of people watching this who've had lower back pain or potentially will have it in the future, I think that conversation is nice to have with your therapist, isn't it, as well? So they can have that. So one of the most common questions I know we get asked is, while I've got it, what can and what I cannot do?
Okay, so this is, I think probably what's important to talk about first is actually what we know works for managing back pain and what the evidence tells us. And this is a really hard one, because every single person is different. We have different bodies, we have different lifestyles, we have different demands on our bodies in terms of what work requires us to do, what our hobbies require us to do. We have different stresses in our lives, and different thoughts and beliefs about back pain from perhaps what we've experienced in the past or seen family members or friends go through. So to treat everybody with a one kind of set program is never going to work. And I think this is where the challenge has been with research around back pain, is that everyone's so different. So it's been very hard to actually target treatments and assess it in research to know, you know, what's helpful and what's not. Well, the one overriding treatment we do know, which is above and beyond everything else, and people probably aren't going to be surprised by us saying this, is exercise. The benefits are huge. We know that exercise can prevent back pain. It helps you recover from episodes of back pain, and it's got huge benefits in terms of our general health, reducing cardiovascular disease, diabetes, improving depression, which are all factors that can influence getting back pain in the first place. So exercise is the absolute key. In terms of what exercise is best for people, this is where it becomes a challenge. The research has not shown us that one type of exercise is superior to another in helping back pain. So we can't say that doing Pilates will help you more than going out for a run, or going for a walk is better for you than doing yoga. All we can recommend is that firstly you exercise and you do it regularly and consistently. and that you try and include strength, flexibility, and aerobic exercise as part of that, and that's what's recommended. I think individually, as a clinician, and I know you're the same, Andy, is that we use all the information about you and your life to help us build a program that is suited to your needs.
Yeah.
So I suppose when people come to us firstly with acute back pain, we look at, okay, well, we know you need to move. We know that's what's going to help you improve. I think one thing we probably should comment on is that we know in that 6 to 12 weeks, you will probably get better anyway, just with time. And like you commented before, our job is to help you create the right environment for your body to enable that recovery process to be as good as possible and to prevent you from going on to have any persistent symptoms. So if we have someone with acute pain, often it's more about, okay, well, what can you do? What movements are you most comfortable doing? Let's go with those first of all, and we will tailor an exercise program into the movements and positions you find most comfortable to purely get the benefit of that movement. But gradually we want to start working you into all the positions that we know your back should and can and is safe to move into. What we tend to find is a problem is that, it might be that someone's back pain started with bending over to pick something up, and instantly they associate bending with their back pain, and okay, well, I'm not going to do that again because I don't want to be in this position again. So they then avoid going into a bent back position.
Yeah.
And if we avoid that movement, we tend to stiffen up into that position. We become deconditioned into those movements. We develop all these unhelpful beliefs and altered movement patterns, and that's when persistent pain can be with us long term, and it affects our normal day-to-day, putting the washing on. It might affect, picking children up, doing our hobbies. So it's really important that once that acute episode of back pain is settling, that we start to work into all the positions we know your back is safe to move into. We'll then tailor your program of exercises around what we know you want to get back to and what demands you are actually going to place on your body going forward, so that we know you've got the strength, the flexibility and the endurance to actually cope with it.
And I think that's some really nice points I just want to kind of highlight to people that Charlotte made there. Was firstly that I think most people, in my experience, is that people have, especially if they've had a history of back pain, what they've started to do is avoid movements, and actually sometimes that's the worst thing they can do. So I think it was nice what you said there is, we start you in position, and then our job is to progress you, or I like the word facilitate you back into that. And then secondly, I think what was really important is that, and that's why I love the way you work, is the sense of what you do is you look at the end goal of what somebody wants. It's not just about getting back to being pain-free and living a pain-free life. You've got 3 young children, you like to do sport, you like to do exercise. That's a lot of demand on the body, isn't it? So
yeah,
getting your body back to that, conditioned enough to cope with that amount of loads, of picking up, they're boys.
2 boys and a girl, but the girl's as robust as the boys, so yeah.
But it's one of those, isn't it, where even if you didn't like your exercise, which we know you all do, dealing with kids, when they're 8, 9-year-old, my own daughter, when she's jumping on my back, and it's still a lot of load to put through the body, isn't it? So being able to do that comfortably.
And I think like a classic example, as you just said, is that you get over that acute episode, life returns to normal and you're kind of normal functional, and you think, okay, I'm going to go and do my HIIT class at the gym that I've always done, and your back pain flares back up again. And it's that process of reconditioning your body to cope with that level of exercise that needs to happen, and not a kind of short kind of hit back into it that your body's not prepared and ready for.
And I think, I know one of this kind of almost links seamlessly into our next kind of point, in the sense of, that's kind of the role we play, isn't it? if that makes sense. So it would just be good for the guys out there just to kind of understand that, you know, if you have got back pain, what is the role, what should they understand the role of a physio to be, and the journey that might be for somebody?
Well, I want to come back to the what can't I do as well, because I think that's really important. Should I just do that before we move on?
Do that.
So, there's nothing you can't do, okay? And I think that's the point to make.
Perfect.
That I think there's something about backs that worries people more than other parts of our body. It is incredibly strong. It is designed to move, it's designed to bend, it's designed to sit slouched, it's designed to sit tall, and it's designed to do all of those things, and you can get back doing all of those things. A fear of not being able to do them is one of those unhelpful thought processes that may render you struggling to do them going forward. So when you're in acute pain, yes, it's about modifying your activity, but to keep you moving. But part of your rehab is to reintroduce all of the things that you can do and should do and will do in the future. So there's you know, in the, you know, no real no-go areas in terms of back pain.
And I think I'll just kind of expand on that. I think it's an important point to make that, you know, I would, you know, it's important to understand then that when acute back pain has settled, actually the journey's not over, and it's important that you still keep working with whichever practitioner you're working with to make sure that you are robust. And I think that's what, is it fair to say that's what some of the evidence is showing actually will help it becoming a problem in the future as well, you know?
Yeah. Yeah, absolutely. So I suppose going on to our roles as physios, you know, a lot of people may just need advice like this, and they'll crack on and they kind of feel fairly confident and they'll get back to their normal activity levels if they did have back pain. I suppose as a profession, you know, it's down to the individual in terms of if they feel they need our support throughout this process. I think if you're struggling to achieve your day-to-day activities, then generally people want to seek help because they want to know what to do for the best. And obviously we are incredibly well qualified to help guide you through that. I think those people who are perhaps more at risk of developing persistent pain, and because of you know, fears and unhelpful thoughts that they've developed over time around back pain, I think we're really crucial in terms of helping that group of people get back to some form of get back to the things that they want to do. So I suppose it's we're here for everybody. The level of support that each individual needs is completely dependent on them as a person. Some people might just need a one-off consultation and advice. Other people might need support over, you know, a good few months with regular contact. That gives them the confidence in terms of their, you know, kind of progress with their rehab, and sometimes people need their hand holding a little bit more. But our ultimate aim for all the people that we support is to get you achieving meaningful activities that give you quality of life and help make you happy. And you know, that our role is to support people with that, and that is varying degrees, you know, varies from one person to another. We, you know, obviously we have a key role in terms of the diagnosis side of things, and you know, we are very tuned into other factors that might contribute to your back pain, and we know what our skill set is, so we can provide emotional support, we can provide advice on sleep and stress management, but that isn't our kind of, I suppose, our core skills or our traditional background. And we know when it would be appropriate to signpost you to other healthcare professionals who can kind of provide that support alongside the physical rehab that we can give as well.
I mean, one of the things that, I like listening to you is because one of the things is what you're very, very passionate about is the individual that you're looking after, isn't it? That comes across so well that I think one of the things you'd hope that if you go, if you have had lower back pain, you have got lower back pain, or potentially in the future, if you do get it, that actually when you go and see a healthcare practitioner, that the consultation should all be about you. It should be about listening to you, individualizing you, and actually giving you, understanding what you want to achieve in your life. And then our role is to facilitate how we do that. And I think, you said that really, really lovely.
I think part of my the reason for my focus on that is that in the role that I do in the NHS trust that I work at is an advanced role. So I tend to see patients who've gone through many cycles of support from physiotherapists or their GP, and it's not helped. And so it's really about unpicking, okay, well, what's been tried, what are your thoughts on it? And often these patients have all these questions that we're talking about that they've never really had truly answered, never really had them truly answered personal to them. And so they remain in this state of anxiety about, well, nobody really knows what's going on with me or what's going on with my problem. And I think addressing that at the very beginning can really help change and shape someone's journey in terms of their recovery. And this is what's good about us doing this, is that actually if we can get those messages to people at the very beginning of their journey and help allay those fears and concerns so that straight away they're on board with what we know works, it can prevent an awful lot of suffering for them later on down the line.
100%. And that's one of my massive passions, that for those of you that know me or have had the joy of having to be treated by me, is one of the big things is my massive passion. And one of the reasons I love talking to you as well is the fact that we don't just worry about what someone's health is now. We want them, the longevity of their lives, to be happy and successful, don't we? And
Absolutely.
so and that's where I think both of our passions lie. Is it's not just getting you right and get rid of the acute pain now, which you quite rightly pointed out, especially in most lower back cases, the body will do that itself. It's the long-term thing that we really care about, making sure that once someone comes
I think perhaps it's important to acknowledge that there is a percentage of people who don't fully recover from back pain. So about 10 to 20% of people will have persistent back pain. And again, I think we have a huge role in supporting this group of people, in that, yes, you've got back pain, but how can we help you still lead a fulfilled life despite it? And that, that may be adjusting the activities that you do, looking at alternative exercise, or just changing how you do your current exercise to help you still achieve. And I think most people, if they know there's nothing serious, if they can still achieve the things that they love in life, then most accept the level of pain that they have and can crack on with it. It's when there's concern and worry and it stops you doing the things that you love that it becomes a huge problem to people. So we've got a huge role there as well.
Good. The nice thing is we both enjoy that role, don't we?
Yeah, absolutely. Well, there's nothing more. I remember you telling me, about a client who used to, do weightlifting and had avoided deadlifts because of back pain, and you rightly gave him the green light after an assessment that it's safe for you to do this, and the realization that actually my body can do it and I'm okay it's the lovely bit of our job, seeing people achieve what they want to do, isn't it?
But I think the fact of that, the reassurance you can give somebody and watching them smile because they can do things they want to do that previously they've been afraid to do. Obviously, after a good assessment, let's put that out, and we're not just condoning just randomly doing it. But and that's what gives me some passion about doing the job I do. And I know you have exactly the same. And it's one of those things where and I think we got the opportunity to help people change lives, and I think that's the fantastic things. And for people out there, we know that your life can change, and if you take the support well. So I think one of the questions that is commonly asked, and the good news is we've only got 2 questions left on our set agenda. You'd be happy to know, what could people be doing? So say you might have had it, you don't have it anymore, or you don't. What things could people be doing to prevent it?
Okay, so exercise. So we know that research supports exercise has a preventative role in back pain. Excuse me, I'm just going to sneeze.
Bless you.
No, it's not going to. Now I've said it, it's gone away. So, but also we can't guarantee you won't get flare-ups in the future, even if you do exercise, but we know that your recovery from those episodes is often quicker and a better recovery if you have regular exercise in your life already. So exercise, something you love and something that you do regularly, is really important. The way you tackle any new activity or exercise, I think, is worth considering, especially if you've had kind of episodes of back pain in the past. And it's not just exercise, it's kind of, I suppose, any lifestyle change, taking on a new job. It may take time for your body to physically adapt to that new role, especially if you've gone from if you've gone from a sedentary sitting desk job and then you start to be more active. They're the times when back pain may rear its head. Equally, going the other way from an active physical job to sitting for longer periods. So I think it's being mindful that those things can trigger back pain, and if you can prepare yourself for that physically, then that would be helpful. There's many patients or clients that I see who take up a new activity, triggers back pain, and they think, I want to get back to it. Why has that happened? Well, actually, if you build your strength and condition up so that you can cope with that activity, then you will, hopefully prevent anything from flaring up in terms of your back.
I think it's a nice point, because I think one of the other things that people find is, and I know our last question is going to kind of lead into this, but one of the things that I think, from my experience and kind of add to that, is that what people do is, a lot of it is it just load too much too soon, don't they? So if you, like you say, if you go, I think that's a great example of work. If you've had a sedentary job and then you've got a stand-up job, you're actually loading the body for a long period of time in a different position. So you haven't had time for the body to adapt. So I think one of the key things is, if you are going to do something new, or you are going to do something a bit, or push your body a bit more, it's making sure you do that gradually, isn't it?
Yeah, absolutely. And I think that's another skill as a profession that we have, is that supporting people with that graded exposure to exercise, which comes naturally to some people, others it doesn't, and that's certainly a skill that we can help teach you, so that in the future you've got the skills to be able to gradually grade yourself with your exercise, to help achieve things. So yeah.
But also push the, one of the things is, if you are quite active, if you take your advice and become very active, also is getting people to trust that actually at that top end, you probably need to be adding quite a lot of loading to help support that high level of activity, isn't it? That's something that, again, that's where you need trust in the healthcare practitioner, because you might not feel comfortable lifting that, but if you want to achieve this level of activity, you have to be strong enough to cope with that.
Yeah, absolutely. I think, did we answer all of that question? Preventing it happening again. So I think, we're both very active people and exercise regularly anyway, and I know, quite a lot of the clients at Summit are the same, but there's many people that lifestyle is a huge factor in pain. So it's not just thinking about exercise, obviously that's hugely important, but there is some research to say that being overweight, having a higher BMI, can make you more at risk of back pain, especially if you suffer with low mood. So we know mood and depression is a factor in developing back pain. Sleep quality, nutrition, stress, anxiety, all of these things are factors in back pain. So looking at your overall life, not just exercise, can be really helpful. And actually, for some people, if they've got an awful lot going on, they can't possibly focus on all of those areas at one time. And I often say to people, okay, look, these are all the things that are contributing to your back pain. What do you feel you could cope with changing at this moment? And, it may be that they say, okay, I feel like I could look at the nutrition side of it and focus on that bit first. So there's many ways to help support your body and back. We know exercise is one of the best ways, but if you are not in a position to be able to do that because of home and work and life commitments, there are other really positive things that you could start to tackle that will help as well.
And I think that's a nice thing for people to understand is there's lots of holistic ways that you can be also doing it, isn't there? There's lots of different things that can be an additional benefit. So I think that's a really nice point.
Yeah.
So we can't, at the current time, I'm filming this, clinic shut, right? So what could people be doing now while
in lockdown?
Yeah, so what can be people doing now? So, we're filming this in the middle of lockdown, so, we don't know how long potentially the sort of clinics are going to be open. So if you are suffering from lower back pain now, or you start with an episode, what would the best advice that you could give to people out there?
Okay, so obviously we know that trying to establish a regular exercise program is really important. If you are somebody who doesn't currently exercise, then that is a great opportunity to start to build a little bit of that into your life. But being really mindful about how quickly you build that up and take it slowly and allow your body to get used to it. We know that whatever it is you enjoy is going to be something you'll keep up with, which is important. So it's a nice opportunity to perhaps start exploring different types of exercise. There's lots of material online that people can tap into, or getting out, walking, jogging, or on your bike. It's all going to be helpful and beneficial. If even just moving more. So there's lots of talk around workstations, lots of people working from home who would normally perhaps have an ergonomically assessed workstation when they're in work with a supportive chair. And yes, that's got its value, but there's no better treatment for your back, the movement. So the fixation on posture isn't perhaps as important as we used to think, and our backs will let us know about it if we sit for long periods slouched, but they'll also let us know about it if we sit upright. So yes, support yourself in a comfy position when you're working, but more importantly, move every 20 to 30 minutes just to get the blood flowing, stretch your joints and soft tissues out into different positions. So regular movement, regular position change, regular exercise, get good quality sleep, try and not indulge too much in the things that probably we all are doing to help us in this situation, alcohol and food, but we know that they can potentially have a negative impact. But if you developed an acute episode of back pain, analgesia does have a part to play in helping you manage those acute symptoms to enable you to move, which we know is the key to recovery. So, over-the-counter ibuprofen, check it through with your pharmacist or GP first of all, just to check that you're safe to take it with other health conditions you might have. But we know that that tends to be the most effective medication to use to support you in the initial phases of acute back pain. I think
the other thing to point out is that as much as most physio clinics are shut, you know, it doesn't even come to us, that, you know, most people are still taking phone consultations, aren't they? I know, and I think the key thing is, if you are, you know, I think if you are moving or you're not quite sure what to do and you do need that bit of reassurance, I think it's important to know that most of us are still here to help and support.
Yeah, and not just for people suffering with acute back pain. Even if you don't have pain, but you've experienced it before and you think, I wouldn't, you know, do I have, you know, some restriction in certain parts of my movement or weaknesses that I could actually use this time while life's a bit quieter to really, you know, focus on. Then again, that's what we're here for. We can, you know, as you know, the questioning is the most valuable bit of our assessment anyway. So some key pointers and key exercises could help you address that. And then when we are out of this, you hopefully your performance, if you're, you know, sporty, will improve as a result of having that work. So
no, definitely. Well, look, I won't keep you. I know you're a very busy lady, and, you know, I absolutely appreciate you giving up this time today. It's been a pleasure.
I hope it will be helpful for people.
I think it has, and, you know, and what we will do is open this up, and if anyone's got any questions, then they can always email them over, and we can maybe, if we're lucky enough, we can get part 2 Charlotte if there's any questions about there. But, you know, listen, I think it's been brilliant. You know, I really appreciate your, you know, sharing your insights, your knowledge and your experience. I think there's some really nice points that people can be taking away from there. You know, definitely for me, I thought it was fantastic. So I really appreciate your time. Thank you very much. Stay safe, stay well.
Yeah, you too. Take care.
See you later. Bye-bye.
Bye.